Thank you. The next question, the member for Scarborough-Guildwood.
Thank you, Speaker. My question is to the Premier. Speaker, we know that the pandemic is not being experienced in a uniform way across the province. While many parts of the province have low case numbers and live in circumstances that help facilitate successful safety measures such as staying home and maintaining distance from others, my riding of Scarborough-Guildwood does not have the same options. Scarborough-Guildwood has been a COVID hotspot since the beginning of the pandemic. A disproportionate number of residents cannot work from home. They are essential and frontline workers. Dense housing and multi-generational family homes, community transmission is also a continuing problem, with a 24% positivity rate, more than twice the provincial average. This reflects the numbers of cases in Scarborough. The vaccine rollout has been unnecessarily complicated and confusing for Ontarians, especially newcomers and seniors. They've faced many barriers booking their vaccine. What is the provincial government doing to make vaccines more accessible instead of chaotic by closing hospital-run vaccination clinics in hotspots like Scarborough?
Thank you. And the Minister of Health to respond.
Speaker, and we have been clear that phase 2 of our vaccine rollout will focus on age and risk while also focusing on hotspots across the province. There have been 114 hotspots identified through postal codes where we understand that there are barriers to people receiving vaccines. There's vaccine hesitancy, there may be language problems, there may be other issues involved with it. We are doing vaccinating people through the vaccine clinics. We also are doing mobile clinics and pop-up testing, going to apartment buildings, going to other locations, using faith-based organizations as well, because these are trusted organizations that people depend upon and rely upon, and we're finding that that's really dealing with the vaccine hesitancy. But with respect to the issue about the shortage in the vaccination clinics, it's important, very important, to remind the member that local public health units are responsible for the managing and overseeing the distribution and administration of the vaccines across their entire region. Similarly, clinics are expected to administer the vaccine.
Thank you. Thank you. Supplementary.
Speaker, back to the minister. You know, 10,000 people in my riding and across Scarborough are now out of luck. They are having to rebook their vaccinations. I was there yesterday at Centennial College. I met Lucida. She is 74 years old. She has had an appointment booked for weeks. She came an hour early for her appointment, had to be turned away. 69-year-old Ramjeet, he rode his bike to get his vaccine only to be turned away. So I understand that we are all in this together. We need to roll this vaccination program out across the province. However, we cannot keep passing the buck on others. It's not the local public health's responsibility to coordinate the distribution. Well, the distribution is decided by the province. If you're telling me that that's not the responsibility, then we've got more to do. But, Mr. Speaker, I'm asking this minister, will they send Scarborough an equitable share of vaccines so that they can vaccinate the thousands of people who lost their appointment? Yes.
Thank you. Minister of Health.
And through you, Speaker, I can assure the member that Scarborough is receiving an equitable distribution of vaccines, as is every other part of Ontario. It's based on age and based on risk, and taking into account the numerous hotspots that we understand Scarborough has within its geography. But we have been working hand in glove with local public health units to ensure that there are clear expectations about what allocations public health units and vaccine sites will be receiving. And to be clear, Toronto Public Health has their own Toronto vaccine table that determines how their allocation is distributed within the city. So we know that delayed vaccines are extremely disruptive, but we are working with those local public health units so that they know what allocation they will be receiving, and then they distribute that allocation to all of the vaccine sites. So that is something that we are going to continue to work on with them, but be sure that Scarborough is receiving their equitable share.